Let's talk about physical inactivity. We've been talking about exercise for some time now, which is telling you that we are stressing is that exercise is medicine. You don't have to buy it, you just have to engage in it. Find something you are interested in, do it, and it will help you. Physical inactivity is sedentary behavior, which means that you do not engage in anything exercise. You do not engage in exercise. You live your life just like that. You don't even engage in physical activity, and you not engaging in exercise means that the probability of you burning the fast food you take is very poor, because exercise helps to burn the fats we take, and it has several other benefits. So if you take calorie food, you take fatty food, and you as an individual you do not engage in exercise, it means that those fats will be there, they will not be burned. And if it results to accumulation of fat, the fat in the body becomes too much, it becomes plenty within your system. This will lead to obesity, and obesity, we know that is one of the types of cardiovascular diseases. So you getting cardiovascular diseases, in terms you tend to have heart attack, in terms you have to have heart failure, you have coronary artery diseases, and several other health diseases that are concerned to cardiovascular diseases. So those are some of the things that predisposes us as individual to cardiovascular diseases. Talking about cardiovascular diseases, which are heart diseases and blood vessel diseases once again, what are some of the signs and symptoms you see as an individual that you are developing these heart diseases or you are developing cardiovascular diseases? Most of the times you don't really see any sign. It gets very serious before you start seeing the signs. So most of the time you don't experience anything. That is why we are talking about exercise here. Exercise is very good. It's better for you to prevent it than to manage it. Prevention, we say, is better than cure. But most of the time you don't see anything, but after some time you tend to see that you are experiencing pain in your chest. Nothing happens, you go to bed, you wake up the next day, and then you see that you are feeling chest pain. What is causing that chest pain? It's telling you that something is wrong somewhere. Try go to the hospital and measure it. Let them monitor it for you to know what is going on. You go to bed, you wake up, and then the next day you notice that you are coughing, and this cough is not just a normal cough. Anytime you cough, sometimes you see blood in it. Sometimes you notice that after when you cough, your chest is paining you. It is a sign, it is a symptom that you are developing cardiovascular diseases, or you are developing heart problem, heart diseases, or you are developing blood vessel problems. So these are some of the things you see. You see that there is chest pain, you see that you are coughing. Sometimes you feel very dizzy, and you feel dizzy or you feel fatigued. You engage in something small, you feel that you are very tired, you can't know what to do. All your system, all the body parts are paining you. You feel very weak. The little activity you engage in, you are very weak, you are tired. It is a sign, it is a symptom that is telling you that you are developing cardiovascular diseases. You are developing problem with the heart and the blood vessel. Sometimes another thing we see again is that you see swelling in your legs. You wake up, you sleep, you go to bed with every system of your body being fine. You went to bed, sleep, you woke up, and then all you see is that your leg is swollen, which means that your leg has become very big. There is accumulation of fluid in your lower extremities. What is causing that? It's telling you that there is a problem somewhere. there is problem with the heart, there is problem with the cardiovascular symptoms. Some of these signs and symptoms does not only apply to cardiovascular disease, they are intergent, so it could be signs and symptoms of other diseases too, but our main focus for today is cardiovascular disease, and we are talking about some of the signs and symptoms of it. So you notice that there is swollenness in your legs, the legs are swollen and you don't know what the cause it is or what is causing it. Go to the hospital for checkup. It wouldn't take you anything to do a checkup. If you check it, you would like to monitor it, and that will prevent your death rate. We already said that 7.8 million people die each year as a result of these things. They don't take them into focus, they don't focus on it much, but it's killing a lot of people, and that shouldn't be your portion. Sometimes to some of the signs and symptoms you can see is that there is shortness of breath. You feel that you are breathing, but then the breath is not satisfying you. You are not feeling okay within you. Something is wrong somewhere. Go to the hospital, check it, and know the diagnosis and the treatment procedures you should take in place. There is sometimes too irregular heartbeat. Instead of the heart to beat normally 60 beats per minute, you see that yours is beating like 120 beats per minute. That is very bad, and that is very deadly. You can get heart attack any moment, you can get heart failure any moment, you can get heart infections any moment. So my dear, if you are experiencing any of these things, you notice that you are sweating, unusual sweating, any little activity you engage in, you are sweating, you do something little, you are tired, you are feeling weak, you didn't do anything, but then your chest is paining you, you are coughing and then you feel pain in your chest, you are coughing and then you see blood in the cough. My dear, there is something wrong somewhere. Go to the hospital for checkup. Don't go nowhere. We'll be right back.